All right, Big Ed, which one you doing first?
Let's go with
All right, for how much? 300. All right. Urinary stasis, increased oxalate production, and family history are all contributory to this renal condition. Yes. That is correct. What is urolithiasis or renal stones? All right, we'll give you that one, Ed, but next time don't say yes. Okay. All right. How do I want to make it bigger. I want to make it, oh, never mind. All right. Oops, continue. All right. So, Ed's team got the next question. So what's next? What's to eat? 100. Oops, they cut off my words. These foods are rich in this mineral, which is essential in producing blank. So there should be 2 words in the answer. These foods are rich in this mineral, which is essential in producing blank.
2 words to say. Oh, it's 2 words?
Yep.
Can we steal?
I don't know. We do have a timer. We need a timer.
Can I take this one?
Oh, what you got, Greg? What you got? Help your team out. Greg's on your team. What's your team?
Rich in iron, and it's essential in producing hemoglobin.
That's right. Greg, for Big Ed's team, he said it is rich in iron and essential in producing hemoglobin. You need iron.
No.
Iron. So beans, red meat, and lean fish, poultry, fortified cereals, all those things are rich in iron, and you need iron for the production of hemoglobin. Good job. She's got you. You just bought yourself a burger or something like that. Fine. That's what she brought me. All right. So, what's next? Big Ed and the ladies. Ladies. Which one? Waiting to exhale for how much? For 200. This class of blood pressure medication should be used with extreme caution in patients with chronic lung disease. That is right. What is? Beta blockers. So remember, albuterol and the short-acting or long-acting beta adrenergic agonists help with bronchodilation and all that. Of course, beta blockers are going to work against that. What's next? Ladies? Blood flow for 100. Oh, that's all right. The patient with venous stasis should use these to prevent this serious complication. So no, what is the, I'm sorry, so they should use these things up there to prevent this serious complication. That is correct. What is DVT? So foot and ankle exercises, walking, remember those things prevent DVT, and wearing the compression hose. So that's that.
In different area codes.
Lord have mercy.
I got hope.
Oh, Lord. Well, Ed's got ladies. So, ladies, what would you like to
Little
see?
Joe in the house.
Oh, Lord. All right, let's get them focused over here. Joe, pick a question. Just pick a question, Joe.
My back, my neck, 600.
Oh, he's going for the 600. All right, aside from ABCs and vital signs. This is
Neurovascular assessment.
That's right. And what does that
CMS.
consist of?
Circulation,
What else?
motion,
And what else?
sensation.
That's right. We gotta make sure the doctor didn't paralyze you.
Shit,
Right?
you better not
Make sure you
paralyze.
still got feeling in your legs after that spinal surgery, right? So neurovascular assessment and sensation in the lower extremities. What's next? Oh yeah, I do owe you, right? You're right. You're right. I think I owe you more than that. How many? Oh, how much?
For the plus.
Bullshit.
I gotta add
There
them.
we go.
And then put plus for them, they got
Bird, get you some.
200.
Bird.
Yeah, I think that I owe them like 700. All right. All right. So what's the next one? What's next? Light, of course, Amber would select lighting up for 420. Can we round down to 400? Would that be okay? All right. 420 rounded to the nearest 100 is syndrome. You go, girls. I couldn't even read it. So SIADH, syndrome of inappropriate antidiuretic hormone, will lead to hyponatremia, right? I'm gonna be holding on to excessive water, right? And I'm gonna be, my urine is gonna look like what? Concentrated, right? My urine's gonna be concentrated. My specific gravity is gonna be, and I'm gonna have hemodilution, right? All right, what's next? Oh yeah, the points, Lord Jesus.
This man working my last nerve.
Oh yeah? For how much? How bad is he working your last nerve?
600, dog.
I'm 400. I'm not there yet.
400.
Oh,
This
come on.
is the most reliable indicator of pain.
No, you want me to answer what the patient states.
That's right. Pain is what the patient says it is, right? Pain is what the patient says
Man,
it
put
is,
that
no
on the
matter
final,
what.
lady.
I'm telling you, I made the final nice and easy for you guys. This is our review for the final, okay? I've been mean to you all semester.
Yeah.
I'm trying to, make sure we all just get across the finish line and have this nice, long break. Boy, prepare.
Y'all picked 100. Y'all picked 100.
Okay, go back.
Because we went big.
Let me see what Fran Treva wants to pick. Fran Treva, are you in there?
Hey,
These people
Carly.
tripping in here, girl. Treva, pick a question, girl. These people are getting aggressive.
All right, let's go with it's all about that base for 300.
All about that base for 300.
She was on my team, by the way.
Okay, Treva. Oh, she's one of the hoes. Is that what it is?
She's my mental health help.
Oh, Lord.
My clinical
Oh,
mental health
Lord.
help.
All right, well, Fran Treva, warm, flushed skin, disorientation, hypoxia, and hypotension all accompany what? Acid-base imbalance. You can help your team out, Lil Joe. Which one? Respiratory acidosis. Your team swooped in to help you out, and that is correct. Respiratory acidosis. So what kind of things can cause respiratory acidosis? Yes,
Overdose.
opioids. Why? Because they cause respiratory depression, COPD, sleep, sleep apnea. So anything that's going to cause me to retain CO2. So these are the signs and symptoms that go with respiratory acidosis. Good job. I don't know who that go. Oh, that went to Lil Joe now. I think I gave you the points already, right? Oh, okay. Sorry. Excuse me. All right. Now we're going to toss it back to this side. I'm all about everybody is a winner. Yeah, she gave you a chance, and now it's her chance. It's her chance. It is her chance now, okay? All right.
Make sure you focus. Make sure you focus.
Okay. Yulima. What are you gonna pick? Oh, surprise, surprise.
MRs, girl, go 6.
600. Working my last nerve. Severely elevated blood pressure, history of hemorrhagic stroke are all contradictions of use of this medication. And let's say in the event of a stroke, this medication is contraindicated. How do we treat strokes, certain strokes?
Oh.
Yeah, what this medication is used to treat a stroke. Greg, help you team, Greg.
Greg, put down the beer.
Yeah. TPA, right? Alteplase, however you want to call it, but TPA, that is the clot buster. It is contraindicated. It is used to treat ischemic stroke, but it is not meant for everybody. So if the patient's blood pressure is excessively high, if they've already had issues with bleeding or history of a hemorrhagic stroke, you can't give them TPA. So that's that. Good job. Good job. Big Ed. Saving the team. All right. What's next? Ladies, Apollos. For 100, keep it. Oh, 3? Oh, wait. Let's get it. Let's get it. All right. Don't look at that one. Smoking, lack of keratin and vitamin E, hypertension, and short stature places patients at risk for this age-related central loss of vision. What's the central loss of vision? It's age-related. Macular degeneration. Good job. So smoking, remember, smoke is a risk factor for any and everything. Smoking, lack of vitamin E, keratin, hypertension, short people for some reason, I guess, lose their central vision. Females, but yeah, it's an age-related. Glaucoma is loss of what vision? Peripheral. Glaucoma is loss of peripheral vision. Macular degeneration is loss of the central vision, and it's common. It's an age-related vision loss. All right. So, oh, ladies, they about to cut me. All right. Where's my bottle at before she takes it back? What's next? Over here, Sherry Ann. Oh wait, actually, you Celine, what you doing back there, girl? You writing a book? You filling out a job application? You are? Look, she's like, yes, I am. Oh, okay. Oh, she's the recorder. Okay. So what question you're gonna answer, you Celine? Come on, show out. Just pick one. Which one? Light it up. You so living. All right. Constipation, lethargy, depressed deep tendon reflexes, and renal stone formation are all signs of this electrolyte imbalance. Hypercalcemia. Oh, you guys are ready. We don't even need to take a final. Let's just go home. Yeah, you guys are all winners. Yep. Oh, don't worry. When this is over, I'm gonna email you the link to the game, okay, and the video. So you don't gotta be trying to write as fast as possible, Joe. You can calm down, all right? Yeah, it'll still be there. All right, let me put the points for somebody cut me.
Your last question's a big right.
Oh, she's going big. All right. What form of skin cancer do you suspect here? Nipple. That is correct. That is the basal cell carcinoma. Remember, the squamous cell carcinoma is all crusty looking, might be bleeding. Basal cell carcinoma is more like a flesh or a waxy appearance. It may have that central depression. And then malignant melanoma is all different colors and change, weird borders. Oh dear God. I gotta get one of them, like at the basketball game, I need a little teenager to just be putting the points up. Like you have one job. Yeah. What
That was it.
all right. All right. All right. Little Joe in there.
The Lord.
What's to eat for 600? A 15-month-old with developmental delay is bottle fed only. What nutritional deficiency is the patient at high risk for? If they're just drinking bottled milk all the time. That is correct. Y'all lucky Alec Trebek is here. It is what is iron? It should have been iron deficiency, but also anemia. Iron deficiency going to lead to anemia. So milk-fed babies, babies who are fed cow's milk too early or only exclusively fed milk, these babies need food. They need iron-fortified cereals and fruits and vegetables just like every other human being. Who wants to drink milk all day? Don't worry, I'm putting the points up now. Please don't say anything. All right. Who's next? For 600? All about that base for 600. Hypoxia, sepsis, and severe hypovolemia or shock can lead to this acid-base imbalance.
Come on, guys, you got this.
It's metabolic. All right, nobody got it. It's metabolic
Alkalosis. Come on now.
metabolic acidosis. Remember sepsis, hypoxia, these things put our body into anaerobic metabolism. So we have to start to work, the cells have to function without oxygen. That leads to release in sepsis, lactic acidosis. So sepsis, hypoxia, shock, all those things lead to metabolic acidosis. It's a metabolic problem. But hypoxia, depending on the cause, it is related to respiratory acidosis as well. All right. All right, what's next? Come on, Gertie. What? Don't be saying it like the 400 fever, panic, and overventilation of the patient on mechanical ventilator can lead to this imbalance. So that's yep. Respiratory alkalosis, even though Gertie was scared to say it out loud, it is respiratory alkalosis. So panic, obviously the person's hyperventilating. Fever is gonna cause you to have tachypnea as well. And then overventilating the patient on the mechanical ventilator is the same thing, it's just you're hyperventilating them. So here you go, signs and symptoms of alkalosis, respiratory alkalosis. And again, I'm gonna email you all the link as soon as we get done here. I'm gonna email you the link so you can read through this yourself. All right, what's next? Demeter did. Okay, that's right. It's her birthday. Don't mess up her flow. What? How much? Okay, for she. Oh, she got. Okay, you're right. You're right. All right. Oh, a decreased urine specific gravity and excessive thirst is a sign of this metabolic disorder.
Hypernatremia.
Nope. Diabetes what?
Insipidus.
That is correct. Diabetes insipidus. Diabetes insipidus. Oh, where's that? Oh, I'm on this. Okay, I'm on two different computers. What is diabetes insipidus? Remember, these patients are going to be putting out diluted urine, right? Their urine's going to be watered down and they're going to have hemoconcentration. So they will have hypernatremia. So technically, Greg is right about that part. But the decreased urine specific gravity goes with the diabetes insipidus. And because they're putting out all this dilute urine, they're going to be super thirsty, running out of water. What's next? Hey, the quicker we get through these questions, the sooner we go home. Light it up, 600. These four electrolytes play an important role in cardiac conductivity. He's so weird, but he was right. Potassium, sodium, magnesium, and calcium all play an important role in cardiac conductivity. Oh, Lord. Oh, hell. All right, I'm giving it back to Big Ed and them. Y'all making them look bad. I need everyone to feel good when they leave here. Hey. Okay, here we go. Infectious skin, everything else, 600. 600. When administering eye drops, the nurse should ensure the prescribed amount of medication is dropped here. Not, it is a sac. That's right. What is the conjunctival sac? Give these people some points, man. Yeah.
I thought you were supposed to put the applicator on the iPad.
Well, they're doing that wrong. That part, no. I was just trying to show you where the conjunctival sac is. That looks a little too close. Yeah, I'm gonna guess that's what that
Based on
is.
her eye piercing, I'm gonna say she's not doing
Yeah.
it. Her life decisions are all off.
Well, especially in 2021. I mean, an eyebrow ring, really?
With a little ball.
Like, what is this, 1997?
That's Jingo Jeans, Sarah.
All right, okay. What's next?
Hurry on. Be quiet. Come on, we're on 600.
Waiting to exhale for 600. This sucking in appearance in the center of the patient's chest beneath the breastbone is referred to as what? If you saw this in a patient with hypoxia, what is that called? What kind? What's the location? If it's right here, if it's right here.
Can we steal? They said 4 wrong answers.
Yeah, go ahead.
Substernal.
Substernal. This is your sternum, and this is sub underneath the sternum. So substernal retractions. I believe that was a question on the exam.
It was a picket picture.
Here is a picture of where, let me zoom, see if I can zoom in. Because I know almost everybody got this question wrong.
Go back and forth.
So,
Have shirt off. No, it was subclavicular.
it was, yeah. So again, so supra,
Asking about the muscles you use whenever you're like, what is it called?
for your intercostal muscles,
What
or
was the medical term when they like?
it was asking about,
Sensory muscles you use whenever you're.
yeah, but there was a question about, I thought substernal,
I thought it was gonna be substernal, but it wasn't. It was subclavicular.
yeah.
Accessory muscle used for this challenge when breathing.
So that was really all medical terminology, because the breastbone, that is, layman's term for the sternum.
The what bone?
Beneath there is substernal retractions. And these are other retractions you would see. Just use of accessory muscles when a
That can be
patient,
a hot spot?
and it's not gonna be a hot spot, but I can tell you most of these questions are similar to what's on the exam. So really trying to see everybody. I want everyone to leave feeling good. I mean, it damn near is exact. It's almost exact, okay? I feel like I should never talk bad about breast cholia again in my life, because I done gave you so many answers. It's pitiful. So who's next? Oh, yeah. Yeah, go back. Let Big Ed and them redeem them. So okay, fine. Here's your points, but it's going back to Ed. That's right. Apollos knows what color this is. All right, metabolic. Cool, tepid baths and ice packs may help when treating this acute thyroid dysfunction. So what will be the crisis? Thyroid storm. So Thyroidism, remember everything's in a hypermetabolic state. So now that times 100, that's your thyroid storm. These people are gonna have high fever. They're gonna have maybe hypertension. So one of the treatments for them is to, they're gonna have neurological stimulation too. So you wanna keep the room dark, calm, quiet, treat the fever, cool them down, calm everything down, because they're like at 100 right now. Oh shoot, how come that didn't go? Let me do that again. A lot of this, I'm also trying to address the areas of weakness from the proctored exam. Questions where only 10% of the whole cohort got it right. Tepid is cool. It's cold, a cool bath. Yeah, like, well, it's not hot. It's cool. Yeah. Did that work? Did that take it away? Yes, it did. All right. So what's next? Greg, what you want to pick? Who else is on this call? Who's in here? Who's in this room with us?
All right.
Me twice and Greg and
Sorry, I'm making dinner right now. Or what do we
you're
got?
making dinner. What are you making?
I'm making skirt steak and like squash and Italian seasoning.
Damn, that sounds good. Where's your house at? Can we come over there? Can we finish this
Yeah,
thing
you guys
up?
come
We
on.
got
You guys
wine.
just want to finish that here?
Right. Well, just come over there. We have wine.
Okay.
He said, okay.
Let's do working my last nerve for 500.
Working my last nerve for 500. What are you trying to say, Greg? What are you trying to say? Amitriptyline is in this drug class and often used to treat nerve pain. What is it?
Neuropathic?
What kind of nope, it's not. Well, it's going to treat neuropathic pain, but what kind of drug is it?
What kind of drug is it?
Yeah, what drug
It's
class is amitriptyline in?
Oh, tricyclic antidepressant.
Tricyclic antidepressants. Good job. Tricyclic antidepressants and anticonvulsants are two adjuvant therapies for pain and are definitely used for nerve pain. All right, and we say Greg's on big heads too. So Greg, you're not a lady though. I would never call you that. Yeah, he's got a sidekick this time. All right, who's next? Anybody? Metabolic for 500. Cold intolerance, fatigue, and brittle hair and nails are all a sign of this metabolic disorder. Hypothyroidism. That is correct.
With the weight,
Yep.
just like your mama.
Yes, they gain weight.
It's my thyroid. Always those chicken wings.
Oh Lord, I swear, I'm not gonna lie. Working in family practice, you'll know how many women come to the doctor talk about, I think I have hypothyroidism. What's going on? I've been gaining so much weight. And I'm like, okay, it's TSH is normal, ma'am. I think we're gonna have to look at some other avenues. Yes. Right. Ma'am.
I went like last year, and I was like,
It's like, wait, I know this one. Who does this go to? This goes the biggest. Seriously, I'm pretty sure she could claim you as a dependent. I'm pretty sure.
I'm gonna go with blood in the big C 5.
All right. These precautions should be taken with a patient with a WBC count of 2,300.
ANC, so it's, neutropenic.
That is
Why
correct.
didn't you put the ANC up there, dog?
I mean, you don't need all that.
Come
All
on,
right,
man.
but there.
I thought it was less than 1,000, is it more?
So what are neutropenic precautions, protective precautions?
Restrict visitors that are sick and duty, and hygiene, get in the room, don't be sharing shit, keep the motherfuckers in the room, which that motherfuckers gotta go and get the mask up.
And no fresh flowers, yeah. Don't forget that part. And raw foods, their foods need to be cooked thoroughly, right? That goes for HIV patients too. It's the same thing, a person that's immunocompromised. So, because there was a lot of people got a question on the proctor about HIV and nutrition. And I don't know what the question. Yeah, what was it about? Was it about weight? Was it about albumin? Was it albumin is a lab that would weight? Was it weight loss? Okay, so if you are remediating though, that's one thing. I did write it down, like chapter 2. I forgot I had some tacos. Yeah, I forgot about that.
I forget our point.
Tacos too. Okay, let me put your points in. Golly. Malnutrition on malabsorption. So malnutrition, chapter 3 in the nutrition book, page 15. It talks about manifestations of malnutrition. It also tells you on the next page about like weight loss criteria that qualifies for starvation and malnutrition. So if it's greater than 5% in a month, or greater than 7% weight loss in 3 months, or 10% in 6 months, or 20% in a year. So that's that. And then there, what was the other thing you just said? Some about, what you just say? Oh, the malabsorption, right. Okay, so there was a question about Down syndrome. You need a long-handled spoon. Was that one of them?
That was the right answer though. Well, no, because I thought it was because they always had their tongue out.
Yeah, there's in your book on page 78 in the Pete's book, it says, perform strategies to accommodate for the protruding tongue. A long-handled spoon can be used for feeding to decrease tongue protrusion during feeding. It also says a diet high in fiber and fluid can prevent constipation. And they actually say monitoring calorie intake to prevent obesity.
Can I pick it?
We're talking about that question about the Down syndrome. I think, yeah, because they have a protruding tongue, that's normal for, yeah. Did you get it right? Yeah, because that's a normal expected finding of Down syndrome is a long protruding tongue. They have very long tongue. That was 70, I think 78. Let me go back. Yeah, because he sticks his tongue out. Yeah, that's part of Down syndrome. Page 78 tells you about, that's in the PEDS book on Down syndrome. All right. Oops, moving right along. All right. Oh, the points? I gave you points, didn't I? All right. What's next? Of course, Amber, of course. 500. Oh, and here you go. Chronic alcoholism leads to this electrolyte insufficiency.
Chronic alcoholism would be- I was thinking hypo. What do you guys think?
Go for it. What we got to lose?
Fuck it. Hypocalcemia. Hypokalemia.
No. Hypomagnesemia. Hypomagnesemia.
That's the same shit though. Hypocalcemia and hypomagnesia are all the same. Those two roll together.
They're not the same, Joe. That's why they hang banana bags in the hospital, man.
That is true. That is true.
Thank you. You know he's on it.
Even though my question was on hypomagnesemia. Now let me go find it in the book. Oh, and see, in this book, it doesn't even tell you, does it? Well, whatever. Hey, good job. Good job. Actually got it from ATI, from their, but I used their pink book, the pink book. Yeah. But hypomagnesemia is associated with alcoholism, that's for sure. I'm just trying to see, is it actually in here? You don't? All right. Now we must consult Google.
Yeah, plus hypomagnesemia, hypocal roll hard.
So, because I'm trying to find where, I can't remember where I read it in the book. No, in your actual med surge book. But basically, because alcoholism inhibits remember, you lose magnesium in urine. You have to have working kidneys to even receive magnesium, because it's only excreted in the urine. So part of the reason why alcoholism, one, it lowers magnesium, but also it inhibits antidiuretic hormone, right? So you tend to pee a lot, and they lose magnesium that way. But you know, I'm gonna look it up and find it and email it to you later tonight at like 4 a.m. No, I brought my book that does have the same pages as yours, because instead of using the one from the school like I was using last night. What were you saying, Joe? I'll find it. But don't worry, this one isn't on the final. So let's keep it moving before Donna passes out. Helping. What's to eat? 500. All right. These foods should be avoided in those with atherosclerosis, hyperlipidemia, and this GI disorder.
So you want us to say the foods, or you want us to say the GI disorder?
What GI disorder?
Can I say it?
Go ahead, Greg.
Crohn's?
He's not on our team.
It is, well, moderated fat should be in Crohn's, but what else needs a low fat diet? This
Oh.
is, all right,
Coli-
Lima knows what it is.
Cholecystitis?
Cholecystitis. Cholecystitis. I know, I heard you say it, and Greg just said it too. Cholecystitis requires a low-fat diet. Atherosclerosis, low-fat diet. Hyperlipidemia, low-fat diet. You want to avoid cancer, low-fat diet. Everything low-fat diet. All right. What's next? Who's next? Which one? Just blood flow, 500. This class of medications is usually prescribed to prevent VTE following hip arthroplasty. I really have no idea. Just start hollering stuff out so we can go home.
Anticoagulant.
Anticoagulant. Heparin, enoxaparin, which is Lovenox. I'm about to say Levaquin. Lovenox, enoxaparin, warfarin. They may get Xarelto. They may get Eliquis. But anticoagulants are typically prescribed for a period of time after you get a new hip. All right. I'm just gonna keep picking stuff. The nurse should feel blank about the patient's understanding of home oxygen use when they say, I will apply petroleum jelly or petroleum ointment to my nares if they become irritated, and I will check my O2 flow rate every other day.
Nervous.
Clearly concerned, nervous. What in the heck is your problem? Like, OMG, are you serious? Like, petroleum jelly?
It's ethanol injection.
Oh, you found it? And what page is that on? 289. I knew it was in there. Oh, see, they got fancy and called it ethanol, so I skimmed right past it and didn't even see it because I was looking for alcohol. So yeah, 289 confirms the hypomagnesemia dilemma. All right, don't mess up my flow. Spironolactone can lead to a reduced amount of this cation. It's a potassium sparing diuretic, so sodium, right? Spironolactone works by acting against aldosterone. Aldosterone causes us to retain sodium, right? So spironolactone is going to reduce my sodium and increase my potassium. All right. Exposure to secondhand smoke, propping the baby's bottle, and non-adherence to an immunization schedule are all ways that parents can cause their children to have recurrence of this. That is correct. Yes. I'm trying to pull everything where we didn't get, everybody didn't get it right on the proctor. And that's how I tried to base the final was based off the stuff you're remediating on. All right. And that's in the otitis media chapter, so whatever. All right, bending over at the waist, coughing, sexual intercourse, blowing your nose can increase what? Not cranial, wait. Intraocular pressure, right? Intraocular, but they will increase intracranial pressure too, right? Same thing. But with the eyes, we're worried about that. All right.
You
Can't even have sex. I know.
Can't bend over enough. Or just that swing.
My God. This reaction to a blood transfusion occurs when blood products are not compatible with the patient's blood type or RH factor. Hemolytic, yes, hemolytic. Same thing that, oh, see, I started writing page numbers and then I was like, I don't got time for this. So it's on your med surg book, page 260. It tells you about the blood transfusions. What's up? Oh, okay, it's hot as hell. Oh, we're good. We don't. No, we're good. We're almost done here. Yeah. ASAP. Yeah. All right. Thank you. All right. And did y'all wait? Did you see his mug? Last semester. Look, Donna, last semester, his girlfriend. All the students knew. They passed that picture around everywhere. I was like, Lord, let me Google myself while y'all around here looking at people. But anyway, so hemolytic, right? That's what happens in with the babies with jaundice, right? Hyperbilirubinemia, because when red blood cells are destroyed, bilirubin is released. And there you go. All right, I'm picking the questions, right? Let me just keep it going. Hyperaldosteronism is going to lead to this acid-base imbalance. Acid-base. Metabolic alkalosis. Somebody been studying, Lord. Metabolic alkalosis. Why? Because hyperaldosteronism is going to cause us to lose an excessive amount of potassium, right? Hypokalemia is associated with metabolic alkalosis. Hyperkalemia is associated with metabolic acidosis. Good job.
Well, you just said hypokalemia.
Hypo, low potassium is going to lead to metabolic alkalosis. High potassium is going to lead to metabolic acidosis. All right. Here's another one. My neck and my back. Following placement of a hair. I'm just being so easy on you guys. This is so pathetic. Following placement of a Harrington rod for the correction of scoliosis. This technique should be used to turn. That's right. Log roll them, baby. Just log roll them, just like that. Keep their spine aligned. And keep
got
them.
that arm in the perfect spot.
You know what I'm saying? All right. It's all metabolic. This insulin requires the patient to be eating within 15 minutes of administration. Oh, Lord. Rapid. What is rapid acting? Regular insulin, 30 minutes. It gives you a 30-minute window. Rapid acting like Lispro is going to work right away. So they need to be eating right away.
Hey, girl, you hungry?
Oh, my God. A ureteral stone can lead to this type of acute renal injury. Remember the 3 different types of acute renal failure? Nope. You said it before. Not post.
Mid. It's urethral.
Pre, right? My ureter is bringing the urine to, oh, I'm sorry, no. It's post, sorry, post. It's bringing it, and I wrote this wrong. I did that wrong. It's post. I put the wrong answer. Don't even look at it. Don't judge me. It's post. Because the ureters carry the urine away from the kidney. Post. I'll go back and change that before I email the link so nobody gets confused. The ureters come after the kidney. All right. Aside from administering supplemental oxygen, this action can result in immediate relief for the patient with, that's right, complaints of dyspnea. We're going to reposition the patient, sit them upright, put them in high Fowler's position. These are things to promote oxygenation and ventilation. What? What's up? It's time to go? No. Oh, the presence. Come on, Joe G. The presence of tall peak T waves. Hyperkalemia. See, you guys are ready for the boards. You should just skip nursing 3. Just go straight to the boards. You've made it. All right. Patients with long bone fractures are at risk for this serious condition.
Pulmonary embolism.
What kind of embolism? Fat embolism, fatty emboli. So, petechiae, a petechial rash on the chest, that is the symptom that differentiates it from a regular PE. Only with the fatty embolus, they get that petechial rash. So long bone fractures, so your long bone is your humerus or your femur. Fractures of those bones are good. Your pelvis.
I understand that, but isn't it very muscular?
Yeah.
Yeah, so if you fracture your femur, isn't it a lot of blood loss?
It's not about blood loss, it's about the release of the globulins,
Well, how many
the fat
globulins are in the
globules.
pelvis?
I don't know.
Superior iliac crest?
I don't know. Maybe you should Google it and come back and do a presentation on your break. All right. What am I trying to put? These are all signs of this nutritional disorder.
On your bones, John.
Or what is it, just malnutrition, right? We have brittle hair. Poor lady with her dry, brittle hair. She really needs a keratin treatment at this point. Hepatomegaly and poor wound healing are all signs of malnutrition. And that's what it was. Page 15 to 16 in the nutrition book.
Hypomegalia or maybe
Hepatomegaly.
sounds like a transformer.
All right. This medication, what's that first line treatment for osteoporosis? Acetaminophen. Tylenol.
Osteo or osteoporosis?
Osteoarthritis. The question, first line treatment for osteoarthritis.
That's why we threw us off. You said ferocious?
Y'all can't read? It was on the screen. Oh, I thought I said osteoarthritis. Look. Tylenol for the osteoarthritis. Blood products should be verified with whom prior to transfusion? 2 nurses, right? So depending on where you work at, it's either 2 RNs or an RN and an LPN, depending on your facility policy. 261 in the med-surg book tells you how to transfuse blood. This diagnostic test should be avoided. MRI. MRI. What is an MRI? I was just reading it in the Jeopardy tone, you know. It wasn't really a question. This type of insulin has a duration of 18 to 24 hours.
That's NPA, dog. Oh, no, that's Jeopardy, sorry.
Yep, and what type of insulin is that? Long acting, so Glargine, Levemir. All right. I know that class, they probably wonder what the heck do we do? Oh, they left? They're probably like, it's always so loud in there. What the heck are they doing in there? Dialysis may be required to correct this electrolyte imbalance. Hyperkalemia. Severe hyperkalemia could require dialysis. All right, we almost there. When using the rescue inhaler, the patient should wait this long between inhalations.
3 to 5. 60 seconds.
Hold up. Hold up.
Isn't it 60 seconds?
Hold up. I'm dying. Hold on. I don't even know where I got, which book I got it from. Let's go. Let's find the page number.
Wait 1 minute between puffs.
Where does it say?
It's on my study guide, but I know I have the book. Go to asthma chapter. It's in there.
That's what I'm looking for. Because I got this straight out the book because I changed it. Because I had a different answer and then I
It's 20 seconds if you're gonna hold your breath. Hold your breath for approximately 5 to 10 seconds. 20 seconds if you can. Is what the book says.
And what does it say for same medications and different medications?
Same medication, you're gonna hold for 5 to 10 seconds. And then between puffs, 1 minute.
I know why I picked this. Hold on 1 second. I know why I picked this. I think I took it straight from the exam. So before I send you off.
You did because I wrote 20 seconds after I wrote 5 to 10 seconds because it was a test question.
Yes, because I got these, all the questions I put on Jeopardy, I got from the exam. I didn't make them up myself.
It's on the respiratory.
I want to look it
I
up.
remember because I don't have it in blue.
Hold up. No, and you know, ATI, they got 12 different, like Joe's always pointing it out. They send you off so bogusly. Let me make sure.
How do you check tympanic membrane on a child? And it had all the options, go back and up and down, up and back. And the answer was up. It was backing out. And the book said backing down.
Okay, all right.
Realize that, but
For the sake of the exam, because this is what it says on the exam. So I think I got this from the book. And for the exam, it says 60 seconds, okay? 60 seconds between each puff. Yeah, so 1 minute, yeah, 60 seconds. So that's what it said. But where did I get, I gotta figure out where did I see this? I got it from ATI.
it was the test.
Oh,
question.
it's, you gotta put the steps in order anyway. So that ain't gonna help you. It's putting it in order. I'm looking at the exam. I just want to make sure I want to send y'all on the wrong path. Okay, yeah. So it must have just came from that. And
It was the first question. I added it to my study guide.
yeah, I know I saw that at ATI.
But then if you look, if you read what it says afterwards, it says hold your breath for 5 to 10 seconds. And it says 20 seconds if you can.
Mm-mm.
It says 5 to 10 seconds is recommended, 20 seconds if you can. Yes, the medication can just first stop the
I don't know where the heck I saw that, but and so 60 seconds for the sake of the test. All right. Common side effect of captopril should be, yep, should be reported. Oh, whoops, what was it? It was cough. What is cough? ACE inhibitors. Common side effect is cough. What's the most serious adverse effect? Angioedema. All right. And here's one more. All right. All of these should be avoided with this peripheral vascular disease. All of these. So we got legs elevated, we got compression, and we got a heating pad. PAD, but it's peripheral arterial disease. If it's arterial, we're having trouble getting blood to the feet. So elevating the legs is not going to help that. They aren't having any problem getting blood back to the heart. They don't need compression, and they likely lack feeling in their feet. So using a heating pad could put them at risk for burns. All right, hypertension, increased risk for bleeding. Hyperglycemia and GI upset are all adverse effects of this supplement. Glucosamine, there you go, glucosamine. Side effects of glucosamine. All right. Patients on a sodium restricted diet should be mindful of increases in this electrolyte when using salt substitute. That is correct. Here is the back of it. It is made of potassium chloride. That's salt substitute. So you have to be mindful of that. Okay. ACE inhibitors, what do they do to potassium?
pee it out. Restrict it.
It causes a risk for increased potassium hyperkalemia. Because ACE inhibitors are going to stop aldosterone from being released, right? If we don't have angiotensin 2, we don't have aldosterone, so we don't have that excretion of potassium. This nursing intervention will help decrease swelling in patients with cellulitis. Elevate the legs. We're almost there, Lord Jesus. And blank, I don't know what I put, in fluid intake is recommended for prevention of, increase, increase fluids, oxygenation, avoiding cold weather, avoiding infection. A monofilament wire is used to test for this complication of diabetes. That is correct. Peripheral neuropathy. Real quick, I'm gonna show you what it is. I hate these things. Hide. All right. Monofilament.
Use a tree, what?
I don't know. Did that test that? Yeah. All right. It is used to test for neuropathy. It's just a little wire, and they're just poking all around your foot. Do you feel this? Is it sharp or dull? Those are testing for sensation for peripheral neuropathy. All right. Almost there, almost there. Untreated glaucoma leads to what? That's right, blindness. That's right, like Ray Charles, all right? You're gonna be blind, all right? All right, dyspnea, fatigue, and sensitivity to cold are all signs of this reduction in red blood cells. Anemia, that's right, that's right. It was the 100 questions, which is super easy now. Expressive aphasia and difficulty reading are often seen with the CVA in this hemisphere? Left. Remember, left is language and logic. Left is language and logic. Reading, speaking.
All the A's are on the left. All
Mhm.
A's on
All right. What's all A's? Oh, apraxia,
All those
aphasia. Okay.
the left. They're all on the left.
All right. All right. Oh, you know what? I never came back to this question. There's no question there. This infection of the kidney can lead to preterm labor, hypertension, septic shock. And if it becomes chronic, it can lead to chronic kidney disease. Pyelonephritis. Yes. What is that? All right. Oh, that's that same question I messed up. I'll fix it before I post the thing. Tachycardia, disorientation, convulsion, slurred speech, and cool, clammy skin. Hypoglycemia. For the exam, you need to know how to treat hypoglycemia. And you know, ATI is super specific. So you need to know, like, how many teaspoons of sugar are you supposed to give? Yeah, it's in the directions for hypoglycemia.
It's 4 to 6 ounces.
It says juice, 15 grams of sugar. So you need to know what equals 15 grams.
It's 4 to 6 ounces.
It could be 3 teaspoons of sugar, a teaspoon of honey. There's some other things too. So go back and look at that. All right, we almost there. All right. Foods, these foods are rich in this and should be avoided in exacerbations of inflammatory bowel disease. Fiber, yes, fiber. So dried fruits, dried apricots. This is flaxseed, and these are oats, all high in fiber. Dried apricots. All right, obesity, smoking, and getting old. These are risk factors for this inflammatory joint disease. Osteoarthritis, obesity, smoking, and aging. All risk factors. No, nothing you can do. Just keep getting older. That is a non-modifiable risk factor. Respiratory depression places patients at risk for which acid-base disorder? Respiratory acidosis could lead to CO2 retention. And CO2 is an acid, so that's respiratory acidosis. Here's our last one. Removal of the thyroid gland. Yes, it's going to place patients at risk for deficiency in calcium, right? Hypocalcemia. Oh, we're almost there. Don't run away. If bright red bloody urine with clots is noted in the urinary drainage bag following a TERT, the nurse should try this before. Yep, I put and increase the flow of the continuous bladder irrigation. So increase the flow. It says specifically in the book.
Yes, it does.
To increase the flow. It is page.
It's
in there somewhere. Page 441. I highlighted it.
It's like halfway down the page there. Keep reading.
Increase the CVI rate. Yeah. All right, you found it? A low pH and a low bicarb is indicative of what? Yes, metabolic acidosis. When the pH is down and the bicarb is down, that is metabolic acidosis. And this medication is the first. Hmm? That's right, albuterol, which is a SABA. All right. And then I had messed this question up, so I'm gonna throw another question in there. And we're all done. So next week is the final. What day y'all want to take it? Tuesday, right? Tuesday we will take the final, and then and you guys got the mental health stuff I sent you? Okay, good. And like I said, the final it didn't seem that hard. Everybody in the day class got an A, so. It's the same final. The final says Dennis / Colia / Oh, she don't use Colias? Oh, Professor Dennis, she know better. Okay. All right. So give me a minute to just make touch-ups. Greg, Frantriva, thank you for joining us tonight. And I'll email everybody the link to this game.
See you next week.
See ya. Have a good night, guys. Frantriva, we got a date on Thursday, right?
Yes, we do, 6:30.
Okay, girl. I'll talk to you then. Have a good
Good
night.